Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
I've had the privilege of attending a session that you delivered at the most recent PIAA Medical Liability Conference on Defensive Medicine and the healthcare transformations in the United States. You've written at length over the years about the negative impact of defensive medicine. You wrote an article in 1999 titled "Billions for Defense: The Pervasive Nature of Defensive Medicine." I think a good place to start would be to ask you for your definition of defensive medicine.
My definition of defensive medicine is actually a very simple one, and that is simply a test, procedure, or therapy that's ordered by the physician primarily to protect himself or herself from liability, rather than because of its diagnostic or therapeutic utility.
What do you consider the economic dollars and cents cost of defensive medicine in the United States, and what is the cost exacted by defensive medicine on the physician-patient relationship in particular?
Yeah, those are actually two great questions. So let me start with the first one. The cost of defensive medicine in the United States has been variously estimated at $55 to $60 billion and as high as $300 billion. But I personally strongly believe that even the high figures grossly underestimate the real cost, because I would argue that virtually all medicine in the United States today is defensive, or that at least defensive considerations enter into clinical decision making. So that, and as we, during this course of the discussion, I'm sure that we can, we have the opportunity to expand a little bit on that point. But generally, my feeling is that almost all clinical decision making is to some degree now contaminated by defensive medicine. The cost to the healthcare system, in my judgment, quite seriously, is almost incalculable. And I truly believe that we will not be able to significantly bend the cost curve until and unless we genuinely take measures to reduce defensive medicine in the United States. Your second question is also a very interesting question, and I think it's a very important one, and I think it's not asked often enough, and again, I think it's an important calculation in the damage of defensive medicine. To some degree, defensive medicine is really a violation of the doctor-patient relationship. I, as a physician, understand defensive medicine. I practice defensive medicine. The vast majority of physicians in the United States, and indeed the vast majority of physicians in the world, interestingly enough, will tell you that they practice defensive medicine. And yet, it is to some degree a violation of the doctor-patient relationship. Now, why do I say that? The physician should be the advocate for the patient. The doctor should not be ordering tests that he or she doesn't really believe are primarily to benefit or have the potential to benefit the patient. One of the most important factors I think to understand about defensive medicine, and that's why the question you asked about definition is an important one. My definition of defensive medicine is really a straightforward one. And therefore, you cannot distort the notion of defensive medicine into being careful medicine or being thorough medicine. Careful and thorough medical practice are good. They are by definition appropriate, and by definition, they're not defensive. So that defensive medicine, all defensive medicine is wasteful. And to that extent, all defensive medicine is an intrusion on the best aspects of a good doctor-patient relationship.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
The patient is generally a layperson, and discussing defensive medicine with other lay people, I often get the response that if there's a chance that I have a specific condition or ailment I want it tested for, if there's any benefit I want it, better safe than sorry. How would you respond to that patient who wants to make sure every avenue has been covered?